are going to talk on this video about endocarditis. I am not actually going to talk about this. I'm going to let this video talk a little bit about it because they have some good animations. Maybe. There we go.
Infective endocarditis is infection of the endocardium, the inner lining of heart chambers and the covering of heart valves. Infection is caused by microorganisms, mainly bacteria, that have managed to enter the bloodstream. Except for rare cases caused by massive blood infections or highly virulent organisms, a healthy heart is usually resistant to infection. This is because bacteria do not easily adhere to the surface of an intact endocardium. Constant flow of blood also helps prevent bacterial attachment, and the bacteria are usually destroyed by the immune system before they can cause infection. An abnormality of the endocardium is typically required for endocarditis to occur. Major risk factors include having prosthetic valves or other intracardiac devices, congenital heart defects, heart valve disorders, hypertrophic cardiomyopathy, and previous endocarditis. Endothelial injury allows for either direct colonization by virulent organisms or the formation of blood clots, which then become the attachment site for bacteria. Infection of the endocardium occurs most often on the left side of the heart. Organisms that cause endocarditis may come from distant infected sites, such as skin abscesses or urinary tract infections, or they may enter the body through a contaminated central line or injection. Bacteria of the normal flora of the mouth can also infect the endocardium if they get into the bloodstream, such as during invasive dental procedures. Causative organisms may vary depending on the source of infection, but streptococci and staphylococci are responsible for the majority of cases. Vegetations formed by bacterial growth may cause heart valve dysfunction, which can be heard as murmurs and may lead to congestive heart failure. Myocardial abscesses and tissue destruction may lead to cardiac conduction problems. Pieces of bacterial vegetation may break free, forming so-called emboli. Emboli travel in the bloodstream and may block arteries. Right-sided infections produce emboli that travel to the lungs, causing pulmonary infarction and respiratory symptoms. Left-sided infections can send emboli to any other organs, including the brain, kidney, spleen, and the heart itself. Tiny emboli may also travel to the skin and eyes, producing small red streaks under fingernails, on fingers, toes, and the whites of eyes. Other symptoms include fever, chills, fatigue, and fast heart rates. Symptoms can develop abruptly or gradually, depending on the type of endocarditis. Endocarditis must be suspected when fever is combined with a heart valve disorder, especially when characteristic symptoms such as reddish spots on fingers or the whites of the eyes are present. But diagnosis usually requires evidence of blood infection and imaging studies such as echocardiography to show vegetations on heart valves or damage to the heart tissues. Treatment consists of several weeks of intravenous antimicrobial therapy. Identification of the causative organism by blood culture is vital to determine appropriate antibiotic regimens. Empiric antibiotic therapy before organism identification may be necessary in seriously ill patients. Some cases may require surgeries to repair or replace heart valves. Potential source of infection must be removed.
Endocarditis. Again, a few extra slides for you. This is, again, the inflammation of the endocardium. It is an inflammation in these valves, and basically what those valves do is keep the blood from going back. If you remember the cardiovascular cycle and the earlier video, your blood's going to come in, and these valves are going to keep the blood from coming back up. And that is the main source of inflammation for endocarditis. And you can imagine that's not great. Tachycardia, hemorrhaging. The main symptom, as the video talked about, was the red spots. Here's your embolism or embolus, can block the vessels. So deep vein thrombosis is one of the things that you will see with endocarditis, and it can come from that dental. We talked about that in the why question. When you have inflammation or you have a dental procedure, that infection can actually get into your heart. See the question that I asked earlier in the Tell Me Why. You will see this on an echocardiogram. This is the best way to diagnose it, especially if you have high-risk patients or you see the red blotches. Pathogens are carried by the blood into the lymph. This is what we talked about with the dental procedures. And really just what's going on one more time. Again, I'll actually probably say it several more times. You have your capillaries. They are kind of leaky. They're not kind of leaky. They're leaky. And that's going to come in here and eventually end up in your lymph. So that is an important reminder. Brucellosis. So this is fluctuating fever that spikes every afternoon. You're fine, and then every afternoon you spike a fever. You probably have brucella. It's an endotoxin. Symptoms, again, caused by ticks, because ticks are the actual worst. I have some questions about this very specific picture. Why? So you would be playing with the fetuses, the dead fetuses of pregnant cattle, but don't. Okay, so if that's something you were going to do today, I'm going to need you to cancel those plans, and not because it's something that you could get brucellosis. This is something that you see in meat, mostly contaminated meat, and you'll see it when they recall red meat, typically from cattle. Again, you can also get it from the consumption of contaminated dairy products. Contact with animal blood, urine, placentas usually requires not treatment, but just to know that you are there, and there are vaccines for animals. Tularemia. So this is rabbit fever. I just call it rabbit fever. You'll probably hear it called rabbit fever. Skin lesions, huge swollen lymph nodes, and it doesn't just come from rabbits, but it is known as a disease of wild rabbits, rodents, and humans, and it's caused by Francisella, and it's known again as rabbit fever. You can also get it from bites, something that has bitten a rabbit that has it, eating undercooked rabbit meat, drinking contaminated water. It's not as common here if you don't have people eating a lot of rabbit meat, but it does get into the food occasionally. I think we covered that. Transmitted via bite of infected tick who has contacted an infected animal. So this is anytime you're around livestock a lot. Small size of the bacteria allows entry through seemingly unbroken skin. Individuals in contact with dead animals are at a higher risk. So people who work on farms, near farms, things like that. Treated with antimicrobials. The plague. Just our friend, the plague. The bubonic plague and the pneumonic plague. Who doesn't love a good plague, right? Okay, characterized by enlarged lymph nodes called bobies. So these are again, it's an enlarged lymph node. We talked about how your capillaries with the blood can get into the lymph node, and this is exactly what's happening. The bubonic plague is spread by fleas, direct contact with a flea, contact with something that's been bitten by a flea, mammals that have it, and you're going to get that inflammation in your lymph node as the first symptom. Also, the pneumonic plague, same symptoms. Okay. Yersinia pestis. This was a card that we learned. So, it's the plague. Basically, it's just the plague. It's caused by Yersinia. And really, the fleas are what's causing it. This is a swollen lymph node. So, this is what your lymph node looks like, 3 times its size. What else do we have? Again, plague, transmitted by contact with infected animal or fleas. Fatal in 50% of cases. The pneumonic plague is fatal in 100% of cases. Both of those are only if they're left untreated. Diagnosis is based on characteristic symptoms. Must be diagnosed and treated immediately, and there are various drugs that help. And also, helping with rodent hygiene and flea hygiene just breaks that cycle. Here's Yersinia, again, and some of the nasty things that cause it. Mostly fleas and direct contact with rodents, things that get bitten. So here in this case, this person has direct contact with these fleas or direct contact with this, and then they turn around and apparently sneeze on this other person, and now everyone has the pneumonic plague, and this one, really, you have to get the bite to get the bubonic plague. This is just a delightful conversation. Okay, Lyme disease. This one is really easy to diagnose because you have this bullseye rash. When you get this, you have Lyme disease. So it's very important that you get that treated. Here's a bigger picture of that. Lyme disease caused by Borrelia. Use of manganese instead of iron circumvents host defenses, and typically spread by deer ticks are the primary cause of Lyme disease. Here is some Borrelia. Here's what it looks like. They have these really great. Borrelia, it looks like flagellum, but that's the actual bacteria. And here's what your normal red blood cells should look like. Here is the cycle. You have the ticks, and basically the ticks are going to bite the deer, but these are the tiny, tiny ticks. These aren't the big things that you can see. Lyme disease is spread by very small ticks often, so that's sometimes why people don't know that they've been bitten by a tick because it's so small, so they get Lyme disease and they're like, no, I haven't been bitten by a tick, and they have. One of the most reported vector-borne diseases in the United States, 3 events contribute to an increase in Lyme disease. Movement of human populations into woodland areas, so people want their own like acreage with woods, or they just like to go to parks. We have protected the deer population, so deer, and getting the tick bites the deer who's infected, and then the tick bites a human, and that's all happening in the woods. And coyotes have displaced the foxes that help control the mouse population, so we have a rampant mouse population and a larger deer population, which, look at this, is really increasing the Lyme disease. Not as much in Missouri, but here's St. Louis, so it is also something that's happening when you're walking in the woods. Lyme disease is a thing. Again, based on the signs and symptoms, but very often it gets diagnosed incorrectly because people don't realize they've been bitten by a tick. Treatment is difficult in later phases, and mostly it's prevented by just wearing some tick repellent is probably the best way to get rid of it. Okay.